Hello everyone, welcome to Logic Medico. If you're new to our channel, kindly consider subscribing to our channel and don't forget to press the thumbs up icon. Thank you for doing so. Today's interesting topic is superficial perineal pouch. So what is perineum? Perineum is a diamond shaped area which is present in the lower part of the abdomen and upper and medial surface of the thigh. This diamond shaped area is where the genitals are located. The anterior portion of this is called as urogenital triangle. And the posterior portion of this perineum is called as anal triangle. So these are the two subdivisions of the perineum. The superficial perineal pouch is present in the superficial area to the perineal membrane in the urogenital triangle. That is the location of superficial perineal pouch. To understand this in detail, I will just show you. This is the pubic symphysis. Always in medical field, diagram is more weightage than the notes. So kindly write diagram. This is the ischium for the ischial tuberosity, and of course this is the ischiopubic ramus. Ischiopubic ramus. What is required we will write. Okay. Here I will show you the deep fascia of the penis or the buccal fascia. This is the deep fascia of the penis or the buccal fascia. Here we have the subcutaneous muscle of the scrotum and dartus muscle and the deep fascia of the scrotum, which is called the Cooley's fascia. Here we have the pyramidal shape fibromuscular node called as perineal body. Perineal body. Here we have one triangular membrane. In 3 dimensions triangular. For time being, it's just a single line. In 3 dimension, it will be like this. Okay. This is called the perineal membrane. Perineal membrane. This area is called the perineal membrane. Same thing I will just highlight here. Yeah, this area is called the perineal membrane. So if at all you are standing over here, you can clearly make out the superficial perineal pouch. So this superficial perineal pouch is bounded by the following structures. Superficially, obviously it will be the skin because it is superficial perineal pouch, no? As simple as this. So superficially it will be a skin of the scrotum, skin of the perineal area, and the Cooley's fascia. So this is the superficial relation or the inferior relation. Cooley's fascia is the deep fascia of the scrotum and the perineum. So that is a superficial relation or the inferior relation. Superiorly or deeply there will be this membrane, perineal membrane. So superiorly we have the perineal membrane, inferiorly we have the Cooley's fascia. Superiorly can also be called as deep, inferiorly can also be called as superficial location. On either side we have this, on either side we have the ischiopubic ramus, on either side. On either side we have the ischiopubic ramus. Posteriorly, we have the fusion of this Cooley's fascia with the perineal body in the center. This perineal body will be here like this, and the perineal membrane. So it's a Cooley's fascia becoming continuous with the perineal membrane. That is a posterior relation. Anteriorly, the superficial perineal pouch is open. This is the most important aspect. Anteriorly, the superficial perineal pouch is open below the pubic symphysis, and it spreads into the spaces of the scrotum, space of the penis, and the superficial inguinal space, anterior abdominal wall. Okay, all these areas it is open. So this is about the boundaries of superficial perineal space. Moving on to the contents. To understand the contents, I will show you two diagrams. One depicting the structures which are holding the penis. I will show you that this is the pubic symphysis lower part. Okay, this is the ischiopubic ramus. This is the obturator foramen, what I am drawing now. So this is the pubic symphysis, right? So here we have something called as The crux of the penis, this portion are called as the crux of the penis. This portion are called crux of the penis. Whereas this portion in female it will be called as crux of clitoris. And here we have the root of the bulb of the penis. Together the bulb and the two crusts, the right and the left crux together, all these three things is called the root of the penis. So the root of the penis or the root of the clitoris is formed by the two crusts, the right and left crux, and the bulb of the penis. Within this, it is made up of two corpora cavernosum and one corpora spongiosum. That is a spongy body. What I am trying to tell is, within this bulb of the penis, the urethra will travel. There will be a spongy body. We call it as corpora spongiosum. Corpora spongiosum. Within this two cavernous tissues will be there. This cavernous tissue we call it as corpora cavernosum or cavernous body. So this is the corpora cavernosum. Two bodies will be there like that, like this. So within this root of the penis, these following parts will be there. Now covering up these parts, there will be muscles. So these muscles helps in erection of the penis and also the ejaculation of the semen. So I'll show you one more time the pubic symphysis and the ischiopubic ramus and this obturator foramen. Same diagram. I'm just showing you separate diagrammatically. Okay, diagrams are important. I'm telling you that again. It's very easy to remember. All that you would remember the muscles name by ICBS. If you remember this, it will give you marks in the exam. So what is IC and what is BS? It's just a small mnemonic. Instead of ICSC syllabus, you remember ICBS. Sir, what is IC? I don't know anything. IC means ischiocavernosus. Sir, why it's called like this? It's coming from the ischium, covering up the cavernous tissue. So therefore, it's called as ischiocavernosus. Covering the bulb of the penis, there will be one muscle which is covering the spongy tissue. There will be a raphe in the center. It's called bulbospongiosus. This muscle will form a raphe. It's covering the bulb of the penis now. So we call it as bulbospongiosus. So ischiocavernosus on either side, bulbospongiosus in the center. These are the muscles covering the root of the penis. In addition to this, we have one more muscle in the superficial perineal space next to the perineal body. Here will be the perineal body. The bottom portion of this body, perineal body, like this. Here we have a muscle called superficial transverse perineum. It is present in the superficial pouch and it is present transversely oriented from the ischial tuberosity to the perineal body. Actually, holding the perineal body in position will be superficial transversus perineum or a transverse muscle present in the superficial perineal pouch. In addition to this, when we have the muscles, obviously we will have the blood vessels and nerves. Okay. So first the root of the penis, the muscles, now coming the nerves and the vessels. So the nerves and the vessels I can tell you in the simplest possible way. I just show you this is the penis and this is the scrotum. The blood vessels and the nerves are going to come from behind the scrotum like this. So they will be called as posterior scrotal vessels, artery and vein. Along with that, the corresponding nerves will be there, posterior scrotal nerves. So in single line, if you want to tell, posterior scrotal nerves and vessels. A branch to the bulb of the penis and also muscular branches will be given. In addition to this, on the posterior surface of the thigh, we have a nerve, posterior cutaneous nerve of thigh. That will also give a branch to the perineum. The posterior cutaneous nerve of thigh will give one perineal branch. The arterial branches can be divided into following. In addition to the posterior scrotal arteries, artery to the bulb of the penis, dorsal artery of the penis, okay, deep artery of the penis, deep within the penis there will be artery, deep artery of the penis, urethral artery. So these are the arteries. I will tell you one more time. Artery to the bulb of the penis, number 2, urethral artery, deep artery of the penis, and on the dorsal surface of the penis we have an artery. Imagine this is the penis. On the dorsal surface of the penis we have an artery. It's called dorsal artery of penis. These are the other contents. So if I have told penis in male, in female it will be clitoris. That's the only change you have to do. Okay, you don't have to write separately in female different contents. What is unique in female is in the superficial perineal pouch, opening into the vagina. If this is the vaginal orifice, opening into the vagina, we have a gland present in the superficial perineal pouch. That gland you have to remember. That gland actually opens into the vestibule of the vagina and it's called the greater vestibular gland. It is a mucus gland which lubricates the vaginal tract during mating or sexual activity. Greater vestibular gland is the gland. Where is the greater vestibular gland present? It is present in the superficial perineal pouch in females only. It opens into the vestibule of the vagina. Therefore, the name greater vestibular gland. It is also called as Bartholin's gland. Whereas in male, we just have the ducts of the bulbourethral gland. Gland is present, bulbourethral gland will be present in deep perineal pouch. That is the next topic for the day. So, only the ducts of the bulbourethral gland will be there. That is similar to the greater vestibular gland in female. So, the greater vestibular gland is present in superficial perineal pouch. So, in summary, superficial perineal pouch is a pouch present next to the superficial area, next to the superficial fascia or the skin area in the urogenital triangle. Boundaries superiorly perineal membrane, inferiorly the skin or the Colles fascia. Posteriorly, these two layers are continuous with one another along with the perineal body. Anteriorly, it is open. It is open into the scrotal space, the penile space, superficial inguinal space, anterior abdominal wall. On either side, there is ischiopubic ramus. These are the boundaries. Moving on to the contents. Contains the crus of the penis, the bulb of the penis. Okay, together it's called the root of the penis. The crux is formed by corpora cavernosum. Its cavernous tissue helps in erection of the penis. The bulb of the penis is formed by spongy tissue, corpora spongiosum. It allows the expansion of the urethra when required. Covering up these things, there will be muscles. On this root of the penis, there will be muscles. The muscles are ischiocavernosus, which helps in erection, bulbospongiosus, which helps in ejaculation of the semen. Then superficial transverse perineum, holding on to the perineal body. All these are supplied by perineal branches, which I'll show you here. The other contents include the nerve, posterior scrotal nerves, perineal branches, muscular branches, okay, and a branch to the bulb of the penis. Arterial branches include posterior scrotal arteries, artery to the bulb of the penis, deep artery of the penis, dorsal artery of penis, urethral artery. Wherever I told penis, you can replace the word clitoris in females. In females, one gland is present in the vestibule, in the superficial perineal pouch, opening into the vestibule of the vagina. Only in females, it's called the greater vestibular gland. It is a mucus gland which produces mucus to lubricate the vaginal tract during mating. Thank you for watching and learning from Logic Medico. If you are new to our channel, kindly consider subscribing to our channel and don't forget to press the thumbs up icon. Thank you once again. Bye. Good day.